So, assuming that you first take care of your lifestyle aspects, meaning sleep, diet, exercise. Actually, exercise would be the first thing I recommend to patients with migraines or anyone else.
That's wonderful to hear. And we actually will have a dedicated interview too this year on exercise and migraine.
That's great. Second on the list that has a lot of evidence and people can do at home, and that's meditation. Another intervention that has really very strong scientific basis. We have studies showing that actually your brain expands. If you do an MRI scan on someone who engages in meditation, their brain expands. In people with chronic pain, certain parts of the brain tend to shrink because of persistent pain. And if someone starts to meditate, that shrinkage reverses itself. You have normal connections between different parts of the brain. So actually your brain expands because you're not growing new brain cells, but there are more connections, more white matter in the brain. And they've shown that with age, we used to think that shrinkage is normal aging phenomenon, but in fact, people who meditate, their brain never shrinks. That's another incentive for everyone to meditate, whether they have migraines or not.
Fascinating. Thank you for sharing that. Can use of non-drug approaches help increase the effectiveness of medications?
That's also true, and also has a major psychological benefit. Psychologists have established that if you feel like you are a victim of circumstances and things are happening to you and you're having these migraines and why am I having this and I cannot do anything about it, so that's called external locus of control, meaning things outside you cause these problems, as opposed to internal locus of control, which means that you have some agency. You can do things. You can control your headaches. You're not totally helpless and hopeless. You can actually take charge. And that change in mentality itself has been correlated with improved outcomes in chronic pain and migraines.
Are there particular acupuncture points that are most beneficial in migraine?
Yes, but most acupuncturists will place many needles, at least 10, 20. But the typical spot is between your thumb and the index finger. And actually, there's a plastic device that you can put on and you press. And if you're having a headache, you can press on that very tender spot. There's a bundle of nerves here. It's called a Hoku point. And if you press, pain gets better, actually. Pain or dental pain or head pain. Unfortunately, just pressing it, it works while you're pressing, and then you let go, it may come back. But if you can just keep pressing, and if you buy that plastic device, you can provide some relief. But acupuncture clearly is more effective. So these are two common points on the head, actually in the legs, or nausea, and sort of many acupuncture points.
Body work, I'd like to talk about light therapy. In recent years, green light therapy has emerged as an effective non-pharmacological option for chronic migraine, with impacts on frequency and severity and symptoms. What can you tell us about how this works?
Well, Dr. Rami Burstein at Harvard, who's really one of the top researchers in the field of migraines, discovered that in animals, if you expose them to different parts of the light spectrum, will actually have less pain with exposure to green light and not any other part of the spectrum. And based on that, they developed a light that's just pure green light as this very narrow spectrum that's proven to help some people with migraines reduce the pain, reduce not just migraine, but pain in general. But green light in general is pleasant. We think that there are evolutionary reasons why green is more pleasant for us. Although there is a recent study that showed that looking at the ocean, the light at the body of water, is even more relaxing than looking at the green forest.
Now, pulling all of this together, when you're considering non-drug approaches in the care of one of your patients, how do you rank them?
Oh, by far, exercise is number one. Meditation is number two. Supplements is number three, magnesium, CoQ10, and others. And then, depending on patient's preference, some people say, I'd love to try acupuncture because a friend of mine had amazing results. That's definitely acceptable.